Hi, this is Dr. Sara Siddiqui, and I'm here to present to you regarding COVID vaccines in children via the Elwood Public Library. And thank you so much for allowing me this opportunity. Let's just bring up the shared screen and go in present mode. Okay. Hi, so I was asked to present this months ago. We developed the monthly schedule, and actually it came up this month that we were going to talk about COVID vaccines in children, and this is a really good time to do it because we just approved, or Pfizer just approved, 12 plus vaccination in children. So I'm getting a lot of questions regarding this at the office, and I thought I would go through it and go through some of the information that I pass on to my patients. So of course, you want to make sure that you always discuss everything with your own pediatrician or medical provider. I have no disclosures to make as of now. I am not representing anybody or affiliated with anybody. I'm basically providing this for informational purposes only, and it's not specific medical advice. So I just wanted to just briefly go into how the vaccine process works and the science behind it. So essentially, the different vaccines that are on the market essentially have an mRNA component, which is the map of the spike protein of the coronavirus. So this is the whole entire image of the virus. The spike protein is the part of the virus that how it attaches and enters to your cells. And so the spike protein is what you build the antibodies to. So you're not getting information on the whole entire COVID virus. You're actually only getting information about how to build the spike protein. So you're not getting any of the virus itself, because some immunizations, different immunizations do work that way, where you get a little bit of the virus, and that's why you build immunity. For example, measles, mumps, and rubella and the chickenpox vaccines are a little bit of the virus, and then you build antibodies so that when you are exposed fully, you can take care of it via your immune system. But this is just the spike protein that you're building the antibodies to, and that provides enough protection so that you don't get the full disease, a much abbreviated version. And we do know that the vaccine does help reduce infectivity. It reduces the chance of hospitalization, and it reduces the severity. So that we do know since the onset of giving out the vaccine and the approval of the emergency use authorization. So what else I like to say is that the mRNA doesn't stay in your system or doesn't stay in your cells. It actually comes into the cell starts producing the spike protein, and then the actual mRNA disappears like a Snapchat, or the actual particle disappears or gets digested by your cells. So it gets the actual protein does not survive. But what does survive is the spike proteins that are made by your cells, and then your immune system takes care of it by building antibodies against it. So the first time you get the vaccine, or the first dose, is an initial presentation, and then your body makes the protein, or the spike protein, and then it makes the antibodies against the spike protein. The second dose usually inspires a little bit more and confirms the antibody, and makes it a little bit stronger and more long-term. There's a couple of different types of vaccines that are on the market now. So Moderna is a 2-dose series that's 4 weeks apart. You have to take it, and it's also mRNA technology. The Pfizer BioNTech is also the 2 doses 3 weeks apart, and then the J&J is also a little bit different in that there's an adenovirus envelope. So there is a little bit of a virus that you get injected to you when you get the J&J vaccine, and that's just 1 dose. Right now, Moderna and J&J are approved for 18 plus, and then the Pfizer is the only one that's approved for 12 plus, and we'll go into a little bit of why that is too. So the possible side effects, usually for most vaccines, the side effects are fever, body aches, sweats, chills, fatigue. You can have muscle aches and pains, because it's basically the immune system is being inspired, and it's your own immune system that's causing some of the reaction. So what I did was come up with some frequently asked questions that that I get commonly asked in the office, and I thought I'd make that into a list and kind of go over it with you. And I thought I'd sit outside. Uh-oh, my microphone has changed. Why is that? Did it? Yeah. So I actually had to re-record this. I was recording it and then I sent it and then I had to redo it because the volume, I believe, wasn't working in the first one. So this is my second time doing it.
Okay, so does the vaccine affect childhood growth and development? And the quick answer is no. We have been studying the vaccine in 12 to 15 years old since July of 2020, around the same time that they started testing for the older adults. They did give the same dosing, and they found that it really had just the side effects that we kind of talked about. Some people had developed an allergic reaction, but the most common, it was a little bit more rare, but the most common reactions were the fever, body aches and pains, myalgias, and sweats, and that usually lasts 24 to 48 hours. There is some information regarding changes in the menstrual cycle to some women that have menses. So they're still looking into that, but the only what the gynecologists and physicians are saying is that what they've noticed is after vaccine or particularly stressful time in your body, you can have changes in your menstrual cycles. It can prolong or it can shorten. This is a very common thing that can happen when your body's stressed. And perhaps this is why we're seeing a little bit of information on this, but there's no long-term issues that have been found. And there's also no exchange of the vaccine into your DNA. So there's no information that that the vaccine changes or is in any communication with your own cell's DNA. What the mRNA is in, it gets into your cell, and then that gets destroyed after the ribosome, which is the part of your cells that build the protein, makes the spike protein. So there is really no communication with your own DNA. As of now, this was just information that I got online just now from Reuters, that in the US, they've already given out 600,000 doses to 12 to 15-year-olds in the last week. So we've been really getting good uptick on the vaccine administration on the kids. So my child already had COVID this past year. Should I still vaccinate, and when would be the best time? So current recommendation is that for mild symptoms, just wait 14 days and you can be vaccinated. The recommendation is to get vaccinated even if you've had COVID, because the vaccine is actually better immunity than the actual coronavirus. But if you had a severe disease and you were treated with monoclonal antibodies or convalescent plasma, you should wait 90 days, so 3 months before getting the COVID vaccine. Is the COVID vaccine more effective in children than adults? So in the studies that Pfizer performed in the phase 3 clinical trial that began in July 2020, and they completed enrollment of almost 50,000 people, but 2,200 participants were aged 12 to 15. And in that, half of them were given the Pfizer vaccine and half of them were given a placebo, which was saline. And it was found that the 1,100 kids that were given the actual vaccine, 0. And this was back in from July on that they studied it, and then they released the study probably a little bit more recently, or they gathered the data more recently, but they found that 0 of the immunized children with the actual COVID vaccine came down with COVID, and the other children did did come down with COVID. So with the placebo, so they found that 100% effectivity, which is better than the adults, which was 94% effective. So the sample size is a little bit small. So we are going to get continuous studies. So I'm not sure if it's going to continue the 100%, but I feel it is going to stay, like I said, the high 90s, 96 to 98%. And comparing that to the flu vaccine on a good year is usually 30 to 40% effective. And the flu vaccine is also recommended because it reduces severity and it reduces transmission and it keeps you out of the hospital. And that's ultimately what we want COVID vaccine to do as well. Does the vaccine provide better or different immunity than natural infection? And yes, absolutely. So the natural infection, you build the antibody to the whole entire virus. You may develop some spike protein antibodies, but it's not specific to that. It depends on how your body reacts when you get the COVID infection. And that's why there's so many different ways that you can get, that you present with COVID symptoms. Some people have mild illness. Some people have really more severe illness, that you lose your taste and smell, which is something that can happen with other viruses, but we found that it's really pathognomonic, which means really indicates that you may have had COVID if you lose that taste and smell. But people develop different reactions. So with the vaccine, you're just building spike protein immunity. So just the spike protein, which is that part of the cell that sticks out, the part of the virus that sticks out, that's what you're building the antibody to. And it's much, much stronger. It's found to be much, much better. And actually, there's some preliminary studies revealing that the vaccine could help with long COVID syndrome. So long COVID syndrome is basically the syndrome that is long-term effects of COVID. So there's lung issues. People have to be on inhalers for long term. There's something called COVID fog, which is basically your memory is kind of a little bit not the same, or you're having trouble recollecting things. And they found that with the vaccine, it can clear that up. People feel that they're all of a sudden they're feeling better. Their fog is lifted up. Their chest symptoms have improved. They can go and run again, or they can climb up and down stairs. So without taking any medication. So they are studying that ongoing, but that's some positive information. My child has allergies. Should they still receive the vaccination? So this was something that was concerning when the initial vaccine rollout began, and they found that there were some few people if they have anaphylaxis to certain allergens, that they had an anaphylaxis reaction to the vaccine. We found that by giving EpiPen or taking precautions and treating early does prevent any long-term or any kind of anaphylaxis if you are aware or if you're feeling those symptoms. But it has been much more rare here in the United States. We do recommend to take your medication with you and at the site, and then observe for 30 minutes instead of the 15 minutes. Okay, so with the allergies, I don't know if I'm still recording. So with the allergies, you want to just make sure that you take those precautions. And is there a blood test to see if my child has any immunity after the vaccine? And yes, there is a blood test that you can do. So there's there's the IgG antibody that we were testing, and definitely there is a spike protein antibody that we can test for that shows if you have immunity secondary to the vaccine. And why is only the Pfizer COVID vaccine approved in younger children at this time? So Pfizer was the only one that studied 12 plus. Moderna does have an ongoing study right now that they're doing for 6 months plus, and they're also studying pregnant women and breastfeeding women that have gotten the vaccine. So we're going to have those results shortly, and then hopefully we will be able to approve emergency use only for the younger children as well. They're saying September or October for that. Am I vaccinating my children? Yes, absolutely. My older kids have already gotten the vaccine, and my youngest, who's not yet 12, so I'm waiting for him to turn 12. And otherwise, if there is something sooner that's for younger children, we will be getting that one too. So I hope that helps. And I apologize that the recording was a little bit interrupted. I think I had a conversation with Eric in the middle. So I'm going to try to send this over. But again, if there's any questions or concerns, please send it into the reference at elwoodlibrary.org or leave comments in the section below, Facebook and YouTube, and hopefully we can answer your questions for you. Some of the other questions that I was getting, because as of now, we do have quite a few children that have been vaccinated, so 600,000, as you saw in the previous slide. As more and more children get vaccinated, we'll know more information. And again, it is an emergency use authorization, so it's not going to be required at this time because it's only emergency use. And the way that it's designated for emergency use is because the pandemic, it was a pandemic that was infecting worldwide. And we needed something quickly to help prevent the spread. And the vaccine does help prevent the spread. It helps prevent the severity, and it prevents it keeps you out of the hospital. So, you know, I encourage everybody to discuss it with their doctor and to think about getting it. So let me stop sharing now, and let me see. Yes, I'm going to stop the recording. So I hope everybody has a great night, and I hope this works. This recording works. Okay, great. Thank you very much. Have a great night. Thanks.